lips are very dry, you're actually bleeding a little bit from your lips. So make sure you drink plenty of water. Keep them hydrated. I'll give you something to moisturize them, okay?
Okay.
And you can kind of see a little bit of the blanching over here. Right over here, and that's going to be our entry point. Right there. And that's it. And you'll see a tiny dot where I just went in. And because we used a little bit of epinephrine, usually there's not a lot of bleeding. That may just be a little bit of pinpoint. Now the most important thing when we do the cannulas is to stay very superficial. If you're a little bit too deep, then it just really gives more of a ducky appearance. But if you stay superficial, we're really going to be able to accentuate the cupid's bow, give her a little bit of fullness, and invert the lips just a little bit. But you should be able to see the tip of the cannula just kind of close to the surface. And sometimes it takes a little practice. But you go in and you want to angle it almost upward where you see the tip. And so now you can see the tip, and we're just going to follow the vermilion border. It should just be a little bit of pressure for you, my dear. You're doing great. And we kind of go where that cupid's bow is, and just slow, steady pressure. And you'll kind of start to see that fullness start to develop as you're gently pulling it back, and you kind of will start to see that increase in the height. And then you just go a little bit underneath it, but again, you kind of see the tip of the cannula, so you know you're superficial. If you inject it too deep or within the muscle, then sometimes you won't get that nice elevation. And you can again see how beautifully the height is created. And we're just going to finish up with a little bit more, and then this side will be done. Give her a little bit more of a central pout, and then just feather it as you just come out a little bit, and just gently massage it. And this part is done, and next we're going to do the bottom. Let me just get a little bit there. Okay. And so you come out almost as you're about to come out, re-angle it, and then what you want to do is just gently push it in, and now you can see the tip right there, so you can see that white area where the tip is. So we're going to just slowly start to do a little bit centrally. We're going to go back in just slightly a little bit posterior to the border, and again, if you angle up, you can see the tip. And then the bottom part is done. And then we'll just take this and just gently massage it towards the end. But as you can see, there's very little bleeding. You can see that beautiful fullness in the lip. And you can see our patient should be quite comfortable. There should be very little pain involved with this. Maybe a little bit of pressure and a little bit of pinching, right?
Mm-hmm.
But not too bad?
No.
Okay. This side is done.
Mm-hmm.
Now we're going to finish up this side. You doing okay?
Yeah.
Wonderful. So again, we can kind of see the blanching. Now I do know some doctors will actually do 2 points of entry, one here and maybe one here. Usually I can navigate both the top and bottom by doing just 1 point of entry. Don't need to go in too deep. Remember, about 1 centimeter out You're going to have your facial artery that's going to come up here and give off branches of the superior and inferior labial artery. And then the angular artery continues over here. So certainly just be mindful of it. Even though you're using a cannula, it is still possible to accidentally cannulate the artery, which is what we don't want to do. And again, just you're injecting slowly, you're looking for signs of blanching. You know, this is one of the things that you really have to think about. You have to do precise injections, don't rush it. And if you can do that, you can really see what a beautiful natural result that creates without creating that duckiness that oftentimes we see. Because she does have smaller lips, you know, it is possible she requires more, but in general I limit it to about 1 syringe per visit. And I may wait anywhere from 2 to 4 weeks before I decide to re-inject it. And same thing, we're going to go in. The hardest part is certainly finding the entry point. And on this side, sometimes I'll even lift up so I can guide the cannula a little bit better, and you kind of see the tip there, and then we're just going to gently follow the course, and there's the tip again. Okay, a little bit of pressure, and then same thing, slow steady pressure, and gently come out, and you'll kind of start to see that little bit of fullness form. Go back in, slightly underneath the vermilion border, and start injecting again. So you kind of just doing multiple rows, and that actually looks pretty good. Maybe just a smidge more over here, just a drop, and that's it. We're done with the top. So again, you can see this beautiful Cupid's bow that we're now able to realize. We're going to just come out, not quite all the way. And then we just reorient. Maybe need to come out a bit more, and you'll see it kind of disengage, and then we'll just gently, and then we're in. So same thing, you see the tip right there, and again, just slow, steady pressure. You want the fullness to be primarily in the center, and then as you're coming out, you feather out just a little bit so you don't get the same thickness all the way through. End up creating a sausage roll that way. And last little bit, and then we're done again in the center primarily, and then as you come out, you can either increase the speed a little bit so a little less product goes, but we are done. And as you can see, it was very comfortable for her. Shouldn't have been a lot of pain, maybe a little pinching right in the center, and then just hold a little bit of pressure. Sometimes that could be a little bit of bleeding, but again, it's pinpoint. And that's it. And now what we're going to do is we're going to clean the area one more time. I'm going to get some gel and invert the top and bottom to make sure there's no lumps actually sitting inside the mucosal surface. And then we'll also hydrate the lips a little bit with some gel or some Vaseline or something. And it just gives it a more plump look and effect. So